What up? It's a tip of the week, and today we're going to discuss what the heck do I do when a patient declines a biopsy? Well, I had a patient come in for routine extractions on their wisdom teeth 116, 17, 32, and what I decided to do is print out the panel that I had for today. Excuse the resolution. So as you can see, these wisdom teeth are pretty routine. I'll put the chief complaint in the listing above. And as you can see here, you see this lesion here, it's actually outlined. And so after I give the patient the informed consent for the wisdom teeth, I let them know, hey, there is potential cyst growing in this area, or lesion, I should say. And the patient was like, okay, well, I went ahead and I performed the surgery. And after I performed the surgery, I let her know, hey, I did in fact see something that I believe needs to be sent out to the lab. And she was like, okay. Well, once we were finishing up, she was like, I don't want you to send that to the lab. I'm like, ma'am, don't you see that this is different than this side over here? She was like, yes. I was like, well, I believe you should get a biopsy. She was like, I'm good. I was like, why? She was like, I don't think there's anything there. I was like, okay. I was like, well, let me just give you your all the pros, cons, and alternatives. Now, just to give you an idea, she is a third year college student planning on going into law school. And I decided to give her this information again, not to think that I would be sued for any matter, but I just wanted to make sure that she had all the information needed to make the best decision. Well, what I then did is this. I was like, hey, these are the pros, the cons, and alternatives, and this is what I would do if you were my daughter. She was like, I'm good. I was like, all right, well, have a good one. And the reason why I felt that way is because I did everything possible. I gave her informed consent about written, I gave it verbal, and also documented her chart. So if at any time there was an issue, I could say, hey, I did everything possible. Now, the reason why I brought this tip up specifically is because we as clinicians are to give our patients the information so they could understand it. But the main important thing is so that they can make the best decision, so they could be confidently involved with their care. So this tip is for you all. Rest assured, and I hope that this tip of the week allows you to smile after surgery.